So hi, my name's Ben. I am a research fellow at the Centre for Dementia Studies, and I also head up program manager for the Determine project. So I'm going to talk today about some preliminary findings that we've got from the Determine project, looking specifically at an early and timely diagnosis of dementia and its associations with quality of life and well-being. Okay. Yes, so I think I've done that. So we're investigating associations of an early versus late and a timely versus untimely diagnosis of dementia on quality of life and well-being of people with dementia. So this data has come from our Determine cohort, the baseline data for our Determine cohort. So this is one of the largest cohorts currently running in England that's set up to examine the post-diagnostic care pathway of people with dementia following a diagnosis of the condition, as well as their carers, and to look specifically at those inequalities that may arise within that care pathway and how we can seek to address them. So there's a number of work streams that feed into the Determine programme, which I should say is funded by the National Institute for Health Research and Economic Social Research Council. And one of these, which I head up, is workstream 6, which is looking at the effect of the diagnostic stage on people's quality of life and well-being, as well as their use of services. So our baseline data was completed in mid-2023, and we have data from 940 people with dementia who had a recent diagnosis or diagnosis of dementia within the first 6 months, most of them within the first 3 months of receiving a diagnosis. And we also have data from 750 of their carers. So why is it important to look at this area of research? Well, many of the global policy directives, and as well as those within the UK, advocate an early diagnosis of dementia. And they see this as a way that we can support people to live well with the condition. So the feeling is that if people are diagnosed early, then this means it gives them a better understanding of the condition. It provides them with access to drugs that may slow down the deterioration of the condition. And it also gives them access to psychosocial interventions and community services as well, which can help to support them to live well with the condition. However, there are potential harms with it. People with diagnosis with dementia report feeling more lonely, losing social networks. If people live in rural areas and they have to give up the car, and this can affect their feelings of social inclusion, accessibility to services as well. So it's an important area to look at and to try and understand the evidence for an early diagnosis of dementia. When we talk about early diagnosis, we're talking about this within the biomedical discourse. So it's looking at diagnosing the condition at the earliest possible stages. So when it's potentially in that kind of pre-symptomatic stage, or response to the kind of early onset of symptoms when they become troubling for the person. So it's looking at the diagnosis from the perspective of the condition itself to try and get it in the earliest possible stages, so that we can try and do things to kind of counter some of the impacts of that. And it's interesting, given that it's quite a major policy directive globally, there isn't a huge amount of evidence on the benefits of an early diagnosis. There's 2 big reviews, one by the Alzheimer's Disease International in 2011 and one in 2016. And they found very few studies, and those that existed, there was quite a lot of weak evidence suggesting it may delay care home placement, and it may also have some impact on people's ability to live longer with the condition. However, both reviews talked about that the majority of the evidence that was being generated for this policy agenda was based on modelling studies or expert opinions of academics and practitioners working in the field, rather than any kind of hard, good empirical data. So sort of a bit of a response to this lack of evidence has led to the emergence of what's known as the timely discourse, or timely diagnosis discourse. Now, this is different from an early diagnosis, the discourse around early diagnosis, and that it's more person-centered. So it's saying that people should seek a diagnosis of dementia when it is timely for them. So when people are willing and able to handle it, willing to have those conversations with their family and with the practitioners, and then delivering the diagnosis when it's timely. So for some people, a timely diagnosis may be that they want to get it in the earliest possible stages. So for them, an early diagnosis would equal a timely diagnosis. For other people, they may not want to know, and they may not want to know at all. So for them, getting no diagnosis would be a timely diagnosis, or they may want to get it later on in the condition. And so again, for them, a late diagnosis in terms of a timely diagnosis for them would be to get it in the late stages of the condition, so late diagnosis. But essentially, timely diagnosis involves working together with the person, the family, and clinicians to say when is it right for you to get this diagnosis, and when will you be able to handle that information and do something with it to benefit yourselves. So there's a bit of emerging evidence, but again, fairly weak because this discourse has only just started to come about, that suggests that a timely diagnosis may be beneficial for both the person with dementia and their carer. There's been some qualitative work examining this, and a carers survey asking people about how timely they felt their diagnosis was, and looking at the impact that had, or the associations that had with ability to live well with dementia afterwards, and both showed some kind of support, some good evidence that some support that this is beneficial for people. Determine has been set up examine this, and this is what we went about doing. So we created both indices of early and timely diagnosis. So from our baseline data set, we were able to create a temporal index of early diagnosis. And what we did was ask people when they first noticed troubling symptoms of dementia, or troubling symptoms that they wanted to seek some help about, and then when they received a diagnosis. And the mean for that was around about 2 years. So we split our sample up here into anybody who was given a diagnosis within 2 years, and we classed them as early diagnosis, and anybody who was given a diagnosis at over 2 years, and we classed that as late diagnosis. We were also able to measure or to determine people's scores on the clinical dementia rating scale. So this is a scale which is looks at mild, moderate, and severe dementia, and it classes it as you get a score of 0, 0.5, 1, 2, or 3. So we were able to say that anybody that was 1 or below, which would be kind of mild dementia, we classed as having got that early, an early diagnosis, and anybody above 1, we said was a late diagnosis. And we also had some self-report measures from both the person with dementia and the carer on how timely they felt that diagnosis was. So these are subjective reports. And people could say here that they felt it was too early, too late, or just about right, so timely. So we classed timely as the timely, and we compared them to people who felt it was too early and too late, who we classed as untimely. And we looked at the associations of these indices on a range of outcome measures. So the DemQual and the DemQual proxy are quality of life measures for the person with dementia. So the DemQual is delivered directly to the person with dementia and assesses their quality of life. The DemQual proxy is a quality of life measure of the person with dementia, but as reported by their carer. And the CDemQual is a carer version of quality of life. All have been developed with the target population, in collaboration with the target population. We also have other wellbeing measures such as the EQ5D, which is health-related quality of life. We have the Office for National Statistics measures of wellbeing, anxiety, and measures around carer burden, Zarat carer burden. So what did we find? Well, very little in terms of outcomes for person with dementia. The ones in red I've highlighted as the kind of significant outcomes. So importantly, there's no harms for either an early or a timely diagnosis of dementia when compared to late or untimely. We did find that there were some associations in terms of the DemQual, that if the person with dementia felt it was timely for them, then it is associated with higher quality of life report for them. Interestingly, if their carer felt that it was timely for them, it didn't necessarily mean that the person with dementia quality of life improved. And actually, for some people, there was kind of a detrimental impact on the person with dementia's quality of life. You can also see the EQ5D and the ONS satisfaction there. If people reported it early, there was some associations with benefits in the EQ5D and perceptions of satisfaction with life. With the carer, though, you can see here that there's there's a lot of benefits or a lot of associations or positive associations. So particularly in terms of timeliness, if the carer thought the diagnosis was timely, then it seems to have positive associations with pretty much all of the outcome measures we have here in terms of quality of life, improved quality of life, lower carer burden, improved health-related quality of life, satisfaction, and lower levels of anxiety as well. And also in terms of our indices of early, both in terms of the time it took to get the diagnosis and the severity of the diagnosis, that does seem to have some influence, positive associations with the carer's quality of life. So key findings in terms of unravelling all of this. Well, firstly, it's important to say that the agreement was poor between the early diagnosis indices and the timely diagnosis indices. Therefore, what we're suggesting is that these are possibly two distinct constructs. So often in reports, people can move between talking about getting early diagnosis to getting timely diagnosis and seem to class them as exactly the same thing. And what I think we've shown here is that they're very much not. They're two very different things. And having an early diagnosis doesn't necessarily mean that is going to be perceived as timely. There was also no correlation between timely for the person with dementia and their carer. So there's a need to explore what timeliness means for both the participants, as well as whether this changes over time. So what does a timely diagnosis mean for the person with dementia? And what does that mean for the carer? Not necessarily going to be the same things. I think what we also showed here is the way we conceptualize the diagnosis point, whether that is early or whether that is timely, does have some implications for the short-term well-being outcomes. So it's welcome that none of these indices are associated with negative outcomes. At baseline, though, timely does seem to be more associated with better well-being outcomes, and that is particularly the case for carers. And again, this supports some of the previous literature I talked about, as well as people like Carol Brain, who spoke yesterday, who advocates for us to refocus on
probably
time.
should come to the end.
Yeah, we have small effect sizes, so that's important to take into account. Within Determine, we are now going to map longitudinally whether these associations exist and whether early and timely continue to play similar roles within that. Thank you very much.